Okay, 12 o'clock rock here on Thursday with Norm Baker. And here we are, Aloha United We stand. We do stand, and we'd love to have you on the show, Norm.
Thank you, Jay. It's great to be here.
You're a great guy, you're a great executive, and you get great pipes.
Thank you.
Let me ask a question, to our friend. We're, kind of promoting the Amazon Echo, and we find it very useful as a sort of another member of our little discussion group. So, Alexa, what time is it?
The time is 12:10.
Oh my God. Okay, reset all the clocks. Alexa, what day is it?
Today is Thursday, February 4th.
Alexa, I love you.
That's nice of you to say.
Alexa, thank you.
No problem.
Very cool.
So if you have any questions during this show, Norm, we're going to talk about collaboration. We talk about the way Aloha United Way collaborates. In fact, any charitable organization collaborates. In fact, I'll go a step further. Any organization collaborates, and that, for that matter, any person collaborates. We live in the nuclear world. We live in the 21st century. We must collaborate if we're going to get anything done, and collaborate, not only collaboration, but healthy collaboration.
Right.
That's what we're going to talk about today.
Yeah, that's exactly where we need to be.
Yeah, let me try this. Alexa, what is collaboration?
Collaboration is working with others to do a task and to achieve shared goals.
All right, there it is.
Very good.
Real simple. She's right.
Yes.
So, could you live without collaborating with other organizations?
For many years, the nonprofit world did. I mean, for many, many years, everybody had their own little fiefdom that they were operating. They had a little silo. They were doing their good work. And as the world got more interconnected and it got more complex, we got more and more towards specialization, and that, I think, is what really drives this whole collaboration piece, because we have very, very specialized providers for very unique services, and if we want to serve a general population, we need to bring all of them to the table in order to do it most effectively. So.
Yeah, I see you as a kind of hub in the wheel.
Exactly.
And it's really it's very symbolic and very important in our times. I mean, I remember when I was practicing law, I would tell a guy who wanted to form a corporation, I would tell him, you're the hub, and you have spokes. And you have to examine every spoke and maybe add some spokes or subtract some spokes in order to connect with the people you need to have with you in a kind of, confederated team. Exactly. You have to have the team, and the collaboration is the way you connect. Without that, in a corporation, you're at risk. You have to have your lawyer, you have to have your accountant, you have to have the guy who runs your computers, all these outside people, and sometimes, of course, inside people, or a combination. But it's the same thing for you. So if you divide we're talking today about collaboration with other organizations, rather than people who would say, come to the offices of Aloha United Way and fix the widget. You're not talking about that.
No, not at all. No, what we mean, I think, is that, collaboration runs a gamut. I mean, it could be as simple as two providers that are doing the same kind of work, getting together periodically and saying, what's working for you, what's not working for you, and sharing best practices. But we think that collaboration needs to move further along, and it needs to come to the point of sharing resources. And in sharing resources, we maximize the benefit of what all of those nonprofits are providing to the client. So that, in the long run, it really comes down to how do we best provide the services that we're trying to deliver to the community without wasting any resources.
Efficiency. It's about efficiency. And if you're going to keep your cost of administrative costs, costs of operation down, you really have to be as efficient as possible. This isn't the only method of efficiency, but it certainly seems to me a really important one.
For sure. And the point you bring up is really important. Many people measure nonprofits by their overhead rate, which is basically how much does it cost to deliver the service. And we watch it night and day. I'll guarantee you I'm on it like a hawk all the time, because we can't allow our cost of delivering the service to get so high that it negates the intent of the folks that are giving to us, basically.
Yeah, so you live in a goldfish bowl anyway. Everything you do is open to scrutiny by all the people who contribute, for that matter, the beneficiaries, and of course the public and the government. I mean, do you sleep at night? I mean, how do you sleep at night?
I don't see it as scrutiny. I see it as being transparent. And
Okay.
if we are going to ask the community to donate money to us in order to assist those in the community that need help, then we have to be totally transparent in how we're handling that money and where it's going, what it's accomplishing. We have to be able to show the world exactly what we're up to, so that then everybody in the community realizes, yes, this is, they're doing exactly what I intended.
So your relationships, you're using the word partnerships, are part of that transparency.
Oh, for sure.
I mean, if I want to know everybody, all your spokes, so to speak, it's all there, probably on your website, or at least for the asking.
Oh, it's all on the website, basically. Matter of fact, the dollars that go to every one of our agencies is listed right on our website.
Now, when we talk about collaboration, we'll examine the concept and the implementation of it. When we talk about collaboration of this discussion, are we talking about your 342 charitable beneficiaries or somebody else?
That's the beginning of it, I think, is collaboration in the delivery of the services. And that obviously involves the 342 odd agencies that we work with, but of course we were trying to bring in business, we're trying to bring in government as well. But that's collaboration at the level of service delivery. And where we're moving to now, I think, is collaboration back at the funder level. So if you think about where the dollars are coming from that are enabling all the nonprofits to do their work, the funders need to sit down as well and try to figure out, okay, a great example today, we're all concerned about the homeless problem. And there's many, many folks out there, many, many different groups that are funding efforts by many, many nonprofits to work on this homeless problem. If we are not all at the same table sitting around talking about what we're doing, the funders I'm talking about now, if they're not at the table discussing what they're doing, we're all going to be shooting in different directions. It's just going to be scattergun. Whereas if we can all come to an agreement that here is an issue that we need to work this one first, and we're all going to put our mind and resources to that one, and then we'll move on to the next issue.
There's really a power in doing that. I just came from a meeting of the Hawaii Energy Policy Forum, and they were looking down the bills that might affect energy this year, and there were 7 or 8 people in the room, some people on a conference call, and they were vetting the bills. And it's so interesting. I walked out early, sorry, but I walked out of that meeting and I said, this is a great example of collaboration, of democracy, of sharing, policy thoughts, sharing aspirations. Vetting bills, you really look into the whole enchilada about, can we do this? Should we do this? Can they do it? There's so many wonderful questions that come out of vetting bills. And so I guess it's the same thing. You're vetting beneficiaries.
Right. Let me give you a really good example, because it's something that has really been reading about for the last 3 or 4 days in the newspaper, actually. We just announced, the mayor announced that we had housed in this year 596 veterans. And that doesn't begin to address the larger homeless problem, but the veterans were a group of homeless that at the beginning of 2015, we sat down and we said, this is a group that we really want to focus our attention on. These folks have served our country, it's our turn to serve them and make sure they have stable housing. So in this year, we have housed 596 of them. There's 50 or 60 left that we've identified that we need to work on.
That's a pretty good percentage.
It is, it's a great percentage. And it came because the VA formed a working group that included all of the players in the homeless service network, and we all agreed, yes, this is something we're going to focus our attention on. We're going to focus on that. Actually, Mayor Caldwell was a part of that because he signed up to something called the 25 Cities Initiative that was actually initiated by Michelle Obama. And it was 25 cities that had the highest veteran homeless populations to get them to actually work actively on that piece of the homeless problem so that then we could at least have a victory in that one area.
You know, I'm getting something on this. You know, lately we've been talking about all these luncheon panel programs we do. You know, we do these luncheon. I think Cindy was on one of them not too long ago, and we, you know, we have these talk fests, and people, you know, make speeches and they ask Q&A. And at the end of the program, everybody always says, "Oh, that was great, Jay. You know, you got to continue the conversation." So really? Why don't you continue the conversation?
Right.
You know, and the problem is continuing the conversation is really a statement. Why don't you do something about it? How about some action? Okay. So, you know, to me, socially, in terms of the society, how do you get, the big question, thinking about all the time, how do you get from the talk stage to the action stage? You know, and it's a question simply stated of socialization. You have to socialize it among anyone and everyone who might, you know, have an opportunity to help or who would otherwise hinder, and, you know, you neutralize the hindrance, that helps a lot,
Sure.
Especially in Hawaii. So, but I'm thinking in this quest that we have to try to get from talk to action. Collaboration is part of the socialization. You have to bring the group together. They have to talk to each other. They have to meld. They have to share ideas, make little intellectual connections, little agreements on, you know, fundamental points. And then now you have a group, you know, that has some solidarity that can actually be on the way to action.
I think that solidarity piece is the real key. And I think that what solidarity in that sort of environment means is all of them agreeing on there is one thing here that we're going to focus our attention on, or one issue that we're going to go, this is the one that we're going to focus on for now, and let's get going on it.
Yeah. So in this show, I want to examine with you what is collaboration, and, you know, right down to the weeds, exactly how do you do it. So you and Cindy, you sit in the Aloha United Way and say, you know, it would be good if we talk to the Veterans Administration and fashion some kind of collaboration with them. Where do you go from that? Because the Veterans Administration could be an old-fashioned silo. Let me just 1 second. Alexa, what is a silo?
Silo is a town in Bryan County, Oklahoma, United States.
Alexa, thanks.
My pleasure.
Anyway, the Veterans Administration could be, and in the past it's been a pretty bureaucratic and ineffectual organization. So, but they have some benefits for you in a collaboration. What do? You pick up the phone, say hi, what do you do?
You know, usually it works the other way. Usually it's the group itself, the VA in this case, who says, you know, we have a charge from our higher ups that says there's a lot of veterans that are homeless in this country right now, and we need to do something about that. And so they then reach out to the community and say, we need help to accomplish this. And I think if I had my, you know, dream, it would be that Aloha United Way become recognized as the place to go when the community has a problem. When the community says we need help with something, turn to us, because that's, you know, at its root, our mission. So very often, that's how these opportunities come to us. They'll call us and say, hey, you know, you're an active player in this homeless issue. You're funding $1 million+ in it right now. We know that you have some connections with all the partner agencies that you're working with. Come and talk with us about how we might address this veterans problem.
It's a deal.
Yeah.
You know, I think every collaboration, whether it's stated or not, is a deal. And you could, you know, parse it out and analyze it and realize that there's consideration, you know, or detriment, you know, benefit or detriment flowing both ways, and both parties really, in a very realistic way, need each other, right? So let's look at the VA here.
Okay.
Okay, the VA needs you because the VA does not have the ability to do what you do in terms of dealing with homeless veterans. You're good at dealing with homeless including homeless veterans. So they come to you and they say, can you help us? So what's in it for them? Well, they're giving you part of their burden. You're actually doing part of what they have to do. And if they didn't go to you, they'd have to go to someone else or be embarrassed that all these veterans are on the street. Okay, so you really help them avoid that embarrassment. Clearly, this is a good thing for them.
Sure.
Why is it a good thing for you?
Because it's what we do. Honestly, I mean, it's, we could get involved in hundreds of these things. We have to sort of pick and choose the ones that we think are going to generate the most good for the community. But I know it sounds cliche, but that's why we exist, is to help the community through issues like this. And the community includes the VA, it includes lots and lots of different organizations like that. And if they come to us and say, hey, we need help, we're going to say, okay, let us see and figure out what we can do.
Okay, we're going to do that for 1 minute now. We're going to figure it out.
Okay.
We have 1 minute for a break. Norm Baker, COO of Aloha United Way, and me, Jay Fidel. We'll take 1 minute and we're going to see if we can figure it out.
Aloha, my name is Justina Spiritu, and I am the co-host of Hawaii Farmers Series. This is my co-host, Matthew Johnson, and you can catch us every Thursday at 4 p.m. at thinktechhawaii.com. What do we talk about, Matt?
So on Hawaii Farmers Series, we're going to be bringing on the farmers and also supporter of farmers, including restaurants, caterers, as well as government supporters and nonprofits to hear their background stories and understanding our local ag community just a little bit better.
Yeah, essentially, there's a lot more that goes into farming and the local food community beyond just producing the food. And we want to feature and get the background story on all these folks and see how we all work together as a community. So join us every Thursday. Aloha.
Norm Baker, that's the word of the day. Hi, Norm.
Jay, good to be back with you.
Good to be with you. So we're talking about the magic of collaboration with a view to understanding exactly how Aloha United Way works and how you can, be the hub of the wheel and the magnet to bring all these forces together, all these constituencies together and actually make this happen. I believe that the human condition requires this kind of hub kind of thing. And then the people who are at the hub are leaders, and they're the ones who make things happen. And they need to have the collaboration too, because humankind is a social animal, like it or not. So anyway, what's in it for you when you enter into a deal with the Veterans Administration is that you do this all the time.
Right.
But why does this, in hard reality, why does this benefit you to take this on?
Well, I mean, obviously we intend to help, and that's why we exist, but we also want people to support us. We want people to come back and say, the last time we had a really serious problem in the community, we turned to Aloha United Way. Aloha United Way did this, and therefore we're going to continue to support them. There's obviously a feedback loop that goes on. People open their wallets and give us money, which we thank them for very much. But then we do something with those dollars, and if we then report back to those who gave to us that this is what we accomplished with the money you gave us, they're going to support us more, and we're going to be able to do more and more good for the community.
Well, it is something when you tell me that you helped 591 veterans off the street.
596.
Pardon me. It hasn't increased in the last 10 minutes, so I guess I forgot the number. But when you tell me that you've helped 596 veterans off the street, it touches my heart. I'm the kind of guy, when I drive into Kaneohe Base, I tell the sentry thanks, and he knows what I mean.
Yeah.
And I always felt that way about it. And so when I see them on the street, it tears me up to know they're there. I mean, this country has to take care of its veterans. It's so important.
Yeah.
Its veterans are the front line, so to speak. Anyway, so when you do that, you're appealing to a guy like me, because I really care about that. And probably a lot of other people. So Aloha United Way cares about our veterans. They're very important. Now, is the Veterans Administration funding any of this, or are they just giving you ideas?
No. I mean, they have their own programs that are VA funded, and they're able to provide some of the assistance, but there's things that they're not funded to do either, and so they turn to the community and say, and it's not just the VA in this situation. As I said, the city and county was invested in it, Partners in Care, which is the umbrella group that looks over the homeless working group, was involved with it. The state was involved. Scott Morishige, the governor's coordinator in the homeless programs, was part of this group. So it was the entire community basically coming together and saying, okay, we have decided that this veterans problem is one that needs to be worked, and we're going to work it. And I think this last year demonstrates that given that kind of focus and given that kind of commitment by the people that are involved with the problem, you can make a significant step forward. Now, 596 out of the 4,000 some homeless folks that we had last year in the point in time count, it's significant. It's a nice number, but there's a long ways to go.
It's a small percentage.
Yeah, very long
We
ways
should
to
talk
go.
about how to apply the principles of collaboration to beating that problem, because it's obviously the most, the most high priority social problem we have. But going back, you gave me the idea now that when you go to Scott Morishige or an organization that's otherwise focused on homelessness, they got their own programs. So, he is a spoke from your hub, but at the same time, you're a spoke from his hub, because he's got his own thing doing. And then, so collaboration also includes the notion of coordination. You're not in your own silo, you are coordinating silos.
Yeah, I think it actually goes beyond coordination. I mean, coordination is certainly a part of it, and that's sort of at its minimum. But as I said earlier, sharing resources, I think, is where that coordination sort of automatically happens, because basically what you're saying is, I'm going to take this piece of it, you take that piece of it. We have to put our heads together constantly in order to make the thing come good. I'll give you a really, really good example, and this is an old example, actually. Back in 2005, boy, it's 10 years. It's hard to believe.
I can't remember that far back.
But 2005, Hawaii had, there's a thing in the federal income tax law, it's called the Earned Income Tax Credit. And essentially, it was passed when they passed the Social Security withhold from our salaries. And the intent was that would offset that withhold for low-income families, this EITC, the Earned Income Tax Credit. And essentially what they did was they paid people back what they were putting into the Social Security fund. Anyway, fast forward, it's now in 2005, and there are 30% of the people in Hawaii who are eligible for EITC are not claiming it. And it's significant. It's $5,000 or $6,000 a year that somebody can get, and all they have to do is fill out the tax form and say, I earned income, here was my total income, and they're going to get a piece of this tax credit, right?
The credit could turn into cash, too.
And it's federal dollars that come back into Hawaii, and these are all low-income folks, so you know that money that they're getting is going right back into the economy. It's going to generate, it's going to go through the food lands, and it's going to go through the everywhere where folks have to spend money.
So what do they have to do? Just file a return?
File a return.
Income tax return.
Right.
But they're not filing returns. They have no money, they're not filing returns.
Many of them don't think they don't have to pay federal income tax because they don't make enough.
Got
So
it.
they say, I don't have to file a form, I'm not going to do anything.
Oh, my
But they've
goodness.
just given away
What a
$5,000.
huge waste.
Yeah, exactly. So anyway, I was at a conference with one of our legislators, and he said, God, that's a terrible problem. And I said, yes, it is. And he says, if we got you some dollars, would Aloha United Way be able to work on that? The exact point I made earlier, when you have a problem, turn to us. And he did, and he got us the dollars, and we set up a program. At the time, it's just really a great story. At the time, there were about 10 nonprofits that every year did free tax assistance for anybody in the community that was low income. And in 2005, they managed to do about 350 returns. They had something like 15 or 20 volunteers that worked on it. It was great, and everybody's going, oh, this is really terrific. There's about $350,000 worth of EITC that they were able to bring back into the community. So very nice, but it wasn't growing. It was kind of stable. And they came to us and they said, we want to grow this. We want to make it better. So at the same time, this legislator offered us these dollars to make it work. We hired a young lady and we went to these agencies and we said, what is it that's missing that if you had it would make this program grow? And their answer was, the things that happen centrally or need to happen centrally aren't being done. Nobody's recruiting volunteers, nobody's advertising this thing, nobody is distributing and working on getting the message out to everybody. We said, oh, okay. So we got this person and she started doing that. Well,
Getting the message out.
getting the message out, recruiting, training all the volunteers, working with the IRS. The IRS actually funds this program. I mean, it's amazing. They want people to claim this, and they fund a program to help. Anyway.
You're a friendly IRS.
Oh, yeah. Probably they're more friendly than we all think, but
Yeah, I
that's
think
the,
so.
Anyway, fast forward. Remember, we started off with about $320,000 or $330,000 worth of returns. Last year, the program did $7.5 million worth of returns.
Wow.
$2 million in EITC, had over 200 volunteers. The 10 original nonprofits that were delivering the program has now grown to about 40. It includes credit unions and folks like that see this as something. And here's the real kicker around it, Jay. The same young lady runs the program, and she is the only person in the program. Not one person has been added to it. She runs the entire thing on less than $100,000 a year and has since 2005, and it has grown like that. And the reason it's grown like that is the collaboration piece.
Yeah.
The collaboration went to the providers and said, here's what we can offer. What do you need? What would make your program better? And just that little bit, and it just grew like crazy.
That's great. That's a great example, too.
Yeah.
I mean, and it shows you how much can be done.
Yeah.
And will be done. You know, this is going forward.
Oh,
The
yeah.
right principles are in play here.
Exactly.
You got to get the word out, and, you know, then you'll achieve. But, you know, I wonder if we could further explore the notion of collaboration, coordination, sharing of resources. Is it fair to say that it doesn't always work?
Oh, yeah.
Give me an example.
We have funded programs based on what we learned from that. It's called VITA, Volunteer Income Tax Assistance. Based on what we learned from that VITA program, we have driven the agencies that applied to us for help to say, you must come to us with partners. You must come as a group that is working on this problem. So we have sort of, if you will, incentivized our partner agencies to work together. And it hasn't always worked because sometimes it's,
Partnerships are frail and
oh,
fragile.
yeah. And the dollars get shrunken up a little bit, and the one agency says, well, I need this, the other one says, I need that. And the way we work it, we always have a lead agency, and then they have 2 or 3 or 4 that are working with them. And of course, the lead agency typically is going to want to protect their own piece of that money. So anyway, there are times when it hasn't worked. There's been a lot of times where it was getting shaky, and we would just intervene and sit down and say, okay, what do we need to do to make this thing work better?
Yeah, and you know, because you've been through that so many
Oh,
times.
sure.
You know, again, the hub and the spoke, you guys have so many connections out there, and that's the value added you bring. And it's not only conceptually that you're helping people and you're getting people to, to join with you in helping by, contributing funds, but it's that you're bringing all of that together. That's the nature of an enterprise. It's like think tech. We bring people like you in, we bring other people to view it, we bring our staff, God bless all of our staff, we bring them in to help us do it. All the contracting parties that we have, we bring them in, we create the enterprise, and the enterprise works. And that's what it's all about.
Exactly.
It's the same thing with you.
Oh, exactly, yeah. And it's one of those things that if you don't have that in today's age, we can't afford it. There's not excess resources around there. We have to have everybody collaborating because we can't afford to waste,
Yeah.
basically.
On that high note, let's take another break. I need to take a breath. Norm Baker, COO of Aloha United Way, talking about collaboration, not only in charitable organizations, but everywhere. We'll be right back.
Aloha, this is Keli'i Akina, president of the Grassroots Institute, and I want to thank you for watching Think Tech Hawaii. We are delighted to be partners with Think Tech because it gives us the opportunity to bring to you a show every week on Monday at 2:00 p.m. called Ehana Kako. Ehana Kako means let's work together, because we believe that Hawaii will be a better place when everybody works together. And in what way? Well, at the Grassroots Institute, we research 3 basic areas, and we invite guests to come on board from across the country, the state, and the nation to talk about a better economy, a better government, a better society. Now, aren't those things we all want? Indeed. If you'd like to have the latest research in terms of public policy, as well as ways in which we can build a better government, economy, and society, then tune in every Monday on Think Tech Hawaii at 2:00 p.m. for our fascinating guests on Ehana Kako. Let's work together. I'm Keli'i Akina with the Grassroots Institute, and I'll see you then. Aloha.
We're back, we're live, we're here with a great guy and a great discussion about collaboration. It's Norm Baker, he's the COO of Aloha United Way, and this is Aloha United We Stand, one of our favorite shows, every Thursday from 12 to 1. So Norm, you know, the secret sauce here is not only that you need them and they need you, but that you can fashion a deal. And it may not be written, it may be a gestalt deal, but somebody is getting benefit, somebody is giving something up, and then on the other side, somebody's giving something up and somebody's getting benefit. So, you know, it's a deal. It's a win-win. You got to create a win-win.
Right.
So how do you do that with somebody who doesn't know about win-win? How do you do that with somebody who has a personality problem, you know what I mean?
Yeah, we deal with those. And, you know, fortunately anyway, we bring to the table the dollars. And you know, that goes a long way to overcoming personality conflicts at times.
You heard it here on Think Tank.
Yeah, people want the funding to do the programs that they're so committed to, and they're usually willing to listen to good reason if the funding is going to be a part of that. So, not that we bend arms or anything like that, but generally when people come to us, they're willing to work with us. It has to be, or they're, you know,
It's not going to happen.
It's just not going to happen, right?
On the other hand, sometimes you have a collaboration with a contributor.
Yes.
And that's, you know, in a funny way, it's the same thing, isn't it?
Yeah, in a way it is. Other ways it's very, very much different, because there's very limited number of people who are funding nonprofits, for one thing. And
Yeah, I think we could also say that, you heard it on Think Tech, there are more people who are beneficiaries than there are contributors. It's kind of an imbalance of sorts, you know.
Yeah, but we have an example of one going on right now that I think is really sort of shows what we want to do. About 7 or 8 years ago, the Hawaii Community Foundation started this by funding a fellow named Ira Chasnoff, Dr. Ira Chasnoff, and he did a study on the Big Island, and his study was around the effect of drugs and other substances on prenatally on children. So what impact were we seeing on child development based on what substances they were exposed to prenatally? Came up with some fascinating numbers. I mean, you find this hard to believe. I did, I can tell you that. Almost 50% of the pregnancies that he saw had some kind of a substance problem associated with it.
Scary.
Very scary. Most of it was alcohol. And so anyway, after 6 years of operating this program funded by the Community Foundation, as I said, he presented the results of his study to Department of Health. And the Department of Health said, wow, this is something that we really need to get our arms around. And they have put together a program that is, it's a crazy acronym, it's SBIRT, SBIRT. And what it stands for is Screening, Brief Intervention, and Referral to Treatment. And so this SBIRT thing was sitting there, and everybody was saying, boy, this is a great idea. And DOH approached us, and then they approached the Omidyar Foundation. And this will be, I mean, this is breaking news, basically. You've got an exclusive, actually,
All right,
Jay.
thank you, Norm.
It's going to be announced in the next day or two. This partnership between Omidyar and Aloha United Way funding a third nonprofit that is doing the work on behalf of the Department of Health, all of which was set up by the forward-thinking funding that Hawaii Community Foundation provided to Dr.
And
Jasnoff.
it's creative.
Isn't it?
Whoever, put this together had, all these pieces, disparate pieces, and realized that if you brought them together, they could do more than the sum of the parts.
Exactly, yeah. And if we can address that problem, Aloha United Way has for years been involved with the developmental screening for kids, because we learned early on that 1 out of every 3 kids basically is arriving at kindergarten so far behind their peers that they're probably not going to catch up. And that behind, in many cases, was because of developmental delays or health issues like hearing problems, vision problems, or some sort of social emotional delay. So we're very vested in solving that problem, and this SBIRT thing actually takes a step further back upstream and says we can do a lot better preventive job if we know that a mom has been exposed to some kind of substance problem, and that is likely to impact the child. Now we know when that child is born, there are things that need, and this Dr. Jasnoff, it's really kind of amazing. He can predict the types of developmental issues that a child will have based on the type of substance that he was exposed to or she was exposed to prenatally, yeah. And so they know exactly this is where we're likely to have a problem with this child, and let's work on it right from birth rather than waiting until 2 or 3 years later when it starts to manifest itself. It's really driving further back upstream to get at the root cause of the problem, which is one of the things we love.
Well, talk about root causes. I mean, you go out and try to do public education on, if you're pregnant, don't be stupid.
It's not necessarily only being stupid, but if you don't know you're pregnant yet, and you have a few drinks the month prior, that could
be in your system.
That could be in your system. It could be a problem, and that's one of the things that this SBIRT looks for. Is I think one of the questions they ask is, in the month before you knew you were pregnant, did you do any of these things and identify some the potential problems?
Okay, so you're going to announce this new collaboration. What's the headline?
A new way to prevent our children from getting themselves.
Whoops, you lost it. Yeah, and for me, the headline is a new way for Aloha United Way to connect and to achieve, new benefits by connecting.
Yeah.
And you keep on doing that, and you will have, continued success, I think.
Yeah, and like you said, we've been talking all along, collaboration is the secret. The secret is, when there's the issue, let's reach out to everybody in the community and say, everybody out there that's interested in this, step up and let's we see ourselves as a convener. I think that's probably the
convener,
the
perfect word for it.
Yeah.
I know exactly.
Yeah.
Alexa, what's a convener?
Sorry, I can't find the answer to the question.
We don't have to train Alexa about this kind of thing. But, it seems to me that the other element here is that nothing is static. Everything changes. Mm-hmm. And if you are, on the ship of the social state, so to speak, and everything is changing by an unlimited number of vectors changing. Mm-hmm. And then, you can't even anticipate all the changes. For example, the Zika virus, okay? Mm-hmm. That could be a problem here. There could be somebody who starts doing research on it. There could be some beneficiaries from victims that need to help. Maybe a need for public education. You could be very useful in that also. But whoever is involved, has to look and see what's new. What are the threats to our community next? Yeah. In fact, even to anticipate them.
Yeah, you have to be nimble too. I mean,
nimble.
Yeah, that's a great example. 2 or 3 years ago, I don't know if you recall, but we had not enough flu vaccine to go around. I don't know if you recall that.
I do remember that, yeah.
Well, that happened, and the Department of Health called us and said, we want to allocate the existing flu vaccines to the folks that are at most risk. And they started allocating it to the seniors and that type of thing. And they did that through our 211 service. And it was set up literally overnight because we have expansion capability in our 211 service. And we just said, sure, come on in, sit down. And the DOH actually brought over 5 folks. They sat down in our space and managed the remaining flu vaccines through our system. You know, if you have the system sort of in place, you can be very, very flexible, very, very nimble when a problem identifies itself.
Well, you know what they say, you know, a person who is a charitable person, whether it's an organization or a person, has the risk of having too many people ask for too many things all at the same time, beyond, you know, capability, beyond resources. And I wonder if that happens. It must happen to you too.
Sure.
People come to you with these ideas, which are really good ideas, but you have to decline. Can you give me some examples or parameters there?
Once every year, we survey the community and we say to the community, what's the biggest problems out there? So we have a list of what we think are the most serious issues that the community has identified.
And it changes every year.
And you know, it doesn't change all that much. It's kind of funny. Although I will tell you that over the last 3 years, the changes have been around seniors and the homeless problem. The homeless had always been a piece of it, but it was always much further down. If you recall, maybe 4, 5, 6 years ago, the drug problem was a far more significant issue in our community's mind. I can remember the lieutenant governor at the time leading a task force around drugs and all that type of thing.
That was Duke Iona's
Big
issue.
yes, it was, yes. And but now that has receded. You know, it's obviously still a problem, but it's not the one that's foremost in everybody's mind.
Right.
Seniors, you know, there's a growing senior population here. There's an awful,
Whoops. Just hold it for a minute.
yeah, an awful lot of problems with it, and so that has bubbled up to the top of our list or near the top of our list, and so that's how we make decisions about where we're going to invest our time. And you're right, there is an awful lot of that's nice, we wish we could work on it, but we really don't have the capability or the capacity right now.
So you have, on the one hand, you're into outreach, you know, trying to be everybody to everything, and then on the other hand, you have to control that so it's within your means. It's a very interesting position you play, and I suggest to you, and maybe you can confirm this, is that over time, Aloha United Way becomes more important as a leader in the nonprofit policy area, not just in doing it, but in figuring out that list of priorities and in executing the plan. And that means more people would come to you, more collaboration.
Exactly, yeah.
Your Rolodex must be huge.
That's very true. I transferred my contacts to my phone, and the phone went crazy.
Norm, it's wonderful to talk to you.
Thank you,
I want
Dan.
you to come back over and over again to
Yeah.
explore, you know, all of the things that you're doing and that you will do in the future, and see if we can, you know, sort of educate people on the other side. You know, when I walk down Bishop Street, I see all these guys, and you know, they're executives or you know, they're middle management, and they have jobs and homes and cars and wives and kids, and everything is working swell for them. But every time I see that vignette here on Bishop Street, I think that's only a fraction of the population. There are a lot of people you don't see on Bishop Street, and they're handicapped, disabled, you know, under the radar, and they're impoverished or elderly, and they don't walk down Bishop Street. And I always think there are really two societies here.
Yeah. You know, one thing I've always said is when somebody says the word homeless, what thought pops into your mind? If you're the average person, you picture somebody in your community pushing the shopping cart and all that type of thing. And you know what? That is absolutely the wrong picture of homelessness. It is more, 52% of the homeless are actually families with kids. And what you saw is actually no more than about 15% of the homeless population, the chronics, the folks but unfortunately, we've all developed the wrong picture in our brain of what a homeless person is, and so it's a little harder to build the compassion piece of it.
Yes, I understand, I agree. A lot of people out there don't really get it.
They just,
But I would like to get it with you. I'd like to have another discussion with you where we tackle the homelessness problem and come up with a discussion of what has been done, what is being considered, what is likely to work, and how very complex it is, and how profound a problem it is for our society. It is really a totally high priority for every
sure.
good reason.
Yeah.
Thank you, Norm Baker, COO of Aloha
Thank you,
United
Jay.
Way.
It's great being here.
Come back soon.
Will do.
Aloha.